In today's video, we'll go through the medications that you shouldn't take with ashwagandha. Let's get into it. Ashwagandha is an ancient herb that's been used for thousands of years as an adaptogen to help relieve stress and various other health benefits. You may think that because ashwagandha is a herbal product that it's safe to take, but there is potential for it to interfere with other medications that you're taking. If you haven't already, you can watch my other video on ashwagandha, but today we'll focus on the medications that you need to be careful of taking with ashwagandha. The first category is immunosuppressants. Medications that suppress the immune system are called immunosuppressants. Since ashwagandha has immune-stimulating properties, it may interfere with medications that are designed to suppress the immune system. Almost all organ transplant patients will be on these types of medications to prevent transplant rejection. People with autoimmune diseases are also often on immunosuppressant medication. Common examples of immunosuppressants include corticosteroids such as prednisolone, hydrocortisone and dexamethasone, Methotrexate and 5-fluorouracil, cyclosporin and tacrolimus, azathioprine, leflunomide and mycophenolate, and biologics, which you'll find as injectables such as adalimumab and etanercept. Number 2, sedatives. Since ashwagandha has a potential to cause a sedative effect, precaution needs to be taken with other medications that make you drowsy. The problem when you take too much sedatives is not only can it make you drowsy, but it can cause respiratory depression, which is when your breathing slows down. Examples of sedatives include benzodiazepines, such as alprazolam, diazepam and temazepam, insomnia medications such as zopiclone and zolpidem, and opioid pain medications such as oxycodone, morphine, codeine and tramadol. Whether you're taking them as an injection, tablets, patches or other forms, they can all still interact with ashwagandha. Number 3, thyroid medication. Ashwagandha may increase the amount of thyroid hormone in your body. While this could potentially be beneficial if you have low thyroid levels, you still need to be careful if you're taking medications that decrease or increase your thyroid levels. Medications for hypothyroidism include levothyroxine, and medications for hyperthyroidism include carbimazole, methimazole and propylthiouracil. Number 4, diabetic medications. Ashwagandha can lower blood sugar levels. If you're already taking diabetic medication to lower blood sugar levels, taking ashwagandha together with it may drop your blood sugar levels too low and cause a hypo. Signs of hypoglycemia include shaking, sweating, palpitations, anxiety, dizziness, hunger, confusion and seizures. There are lots of different types of diabetic medications out there. Some common examples include insulin, metformin, linagliptin, saxagliptin and sitagliptin, semaglutide and dulaglutide, dapagliflozin and empagliflozin, glimepiride and glipizide. Now some people take these diabetic medications for other conditions such as PCOS and weight loss. You still need to be careful of your blood sugar levels. Number 5, blood pressure medications. Ashwagandha can lower blood pressure. If you're taking medications to lower your blood pressure, taking ashwagandha together may cause your blood pressure to go too low. Symptoms of low blood pressure include blurry vision, confusion, dizziness, lightheadedness, nausea, vomiting, drowsiness and weakness. Now there are too many blood pressure medications out there for me to list, but if you have high blood pressure, then it's likely you'll know which blood pressure medication you're taking. Keep in mind you may not actually have high blood pressure, but you might still be taking blood pressure medication for another condition. Some examples are beta blockers such as propranolol, which can also be used to reduce anxiety symptoms and for migraine prevention. Spironolactone, which is a diuretic used in females for acne and hair loss. Clonidine, which is used in ADHD. Prazosin for prostate and PTSD nightmares. And nifedipine for Raynaud's syndrome. So if you're taking any medications that lower your blood pressure, be careful of taking ashwagandha together and monitor your blood pressure. Number 6, blood thinners. When you're on blood thinners, particularly warfarin, you always have to be careful because it has a narrow therapeutic index. This means any small change in dose or blood concentration can cause serious negative effects. Now there's no actual evidence that ashwagandha interacts with warfarin, but you still need to be careful. Speak to your doctor before taking it. So if you take any medications, even if I haven't mentioned it, make sure you speak to your doctor before taking ashwagandha or any herbal products. So that comes to the end of the video. If you found anything useful in this video, please consider subscribing. Thanks for watching and I hope to see you next time. Bye!